CNA anxiety reduction through activity. Welcome to the quiz. Question 1. When providing foot care for a resident with peripheral neuropathy due to diabetes, why is it crucial to test the water temperature with your own wrist before putting the resident's feet in? Option A. To save time, as testing with your wrist is faster than using a thermometer. Option B. Because the resident may not be able to feel if the water is too hot due to nerve damage and could suffer a severe burn without realizing it. Your wrist is more sensitive to temperature. Option C. To make sure the water is warm enough for the resident's comfort and relaxation. Option D. It's a standard part of the procedure for all residents, not just those with neuropathy. The answer is B. Peripheral neuropathy causes loss of sensation, so the resident cannot gauge temperature. Option A is not accurate. Option B is correct because peripheral neuropathy causes loss of sensation, so the resident cannot gauge temperature. Option C is not the crucial reason. Option D is true for all, but the reason is critical for neuropathy. Question 2. A resident in a wheelchair wants to move from one end of the hall to the other. To properly push the wheelchair, you should. Option A. Stand behind the wheelchair, grip the handles firmly, and push while keeping your back straight, bending your knees slightly, and using your leg muscles. This provides the best control and uses proper body mechanics. Option B. Push from the front, pulling the chair towards you while walking backward. Option C. Ask the resident to use their feet to help propel the chair while you guide from behind. Option D. Push from the side, holding onto the armrest and guiding the chair. The answer is A. Pushing from behind with proper body mechanics provides control and safety. Option A is correct because it gives you control and uses proper body mechanics. Option B is incorrect because pushing from front is awkward and unsafe. Option C is incorrect because the resident using feet can be unsafe and may not be possible. Option D is incorrect because side pushing is unstable. Question 3. A resident is in the bathroom and calls out for help because they are feeling dizzy. Upon entering, you see they are still seated on the toilet. What is the first thing you should do? Option A. Run and get a blood pressure cuff and stethoscope to check their vital signs. Option B. Hand them a cold washcloth for their forehead and tell them to put their head between their knees. Option C. Stay with them, check their color and orientation, and call for assistance using the call light. Do not leave them alone. Assess if they feel faint or nauseous. Option D. Help them stand up immediately to get them back to bed before they fall. The answer is C. Never leave a dizzy resident alone. Stay and call for help. Option A is incorrect because leaving to get equipment leaves them unattended. Option B is incorrect because head between knees may not be appropriate and you shouldn't leave. Option C is correct because you should not leave a dizzy resident alone. Option D is incorrect because standing could cause fainting. Remember, we can take your CNA exam for you, remotely and undetected, and with 85% score guaranteed, no fails, no upfront fees, no deposit, pay only after results. Message us via number in bio to schedule your session. Question 4. A resident's family member brings in a favorite food for the resident that is not on the prescribed diet, e.g., a bag of salty potato chips for a resident with CHF on a low-sodium diet. What should you do? Option A. Politely explain the resident's dietary restrictions to the family member, thanking them for their thoughtfulness. Suggest they speak with the nurse or dietitian about appropriate treats that are within the resident's diet order. Option B. Take the food and throw it away when the family leaves to protect the resident's health. Option C. Let the resident have the food, as it's a special treat from family and will boost their morale. Option D. Tell the family member they are not allowed to bring in any outside food under any circumstances. The answer is A. Educating the family respectfully and offering alternatives is the best approach. Option A is correct because it educates the family while being respectful and offers a solution. Option B is incorrect because throwing away food is disrespectful and may damage trust. Option C is incorrect because allowing it could harm the resident's health. Option D is incorrect because a blanket ban is not helpful and may alienate family. Question 5. Which of the following is an example of proper body mechanics when lifting a heavy box off the floor? Option A. Squat down, keeping your back straight and your feet shoulder-width apart, and lift with your strong leg muscles as you stand up. Option B. Bend at the waist, keeping your legs straight, and lift with your back muscles. Option C. Lift the box as quickly as possible to minimize the time you are in a bent position. Option D. Twist your body while lifting to get better leverage and avoid straining your back. The answer is A. Squatting with a straight back uses leg muscles and prevents injury. Option A is correct because it uses leg muscles and keeps the back straight, preventing injury. Option B is incorrect because bending at the waist strains the back. Option C is incorrect because speed doesn't prevent injury. Option D is incorrect because twisting can cause injury. Question 6. A resident who is depressed refuses to get out of bed and participate in activities. What is the most helpful approach? Option A. Sit with them for a few minutes, gently encourage them, and perhaps offer a simpler, one-on-one activity in their room, like looking at a photo album together or listening to music. Acknowledge their feelings and offer a small, achievable connection. Option B. Leave them alone, as they have a right to refuse and forcing them will only make it worse. Option C. Force them to get up and go to the activity room, explaining that socialization will help their depression. Option D. Tell them that lying in bed all day will only make them feel worse, so they should make an effort to get up. The answer is A. Gentle encouragement and low-pressure activities are helpful for depression. Option A is correct because it offers gentle encouragement and a low-pressure activity, which can help without overwhelming. Option B is incorrect because isolation may worsen depression. Option C is incorrect because forcing can increase resistance. Option D is incorrect because telling them they'll feel worse is not helpful and may increase guilt. Great job! Don't forget to subscribe. Bye!